Hello, so this is for educational purposes only, not intended to treat, cure, diagnose, or prevent sicknesses, illnesses, or disease, or mental health issues. If you're thinking about making any lifestyle change to your health and wellness routine for yourself or your family, please consult with your medical doctor first. So, COPD and other underlining health issues. A lot of people that have COPD also may have hypertension, may have lymphedema, may have heart failure, may have other type of illnesses as well. One of the main things that I see a lot of people that have COPD is weight. And a lot of us that are overweight, that means you have a BMI over 30 or a BMI over 60 or a BMI over 70. BMI means body mass index. And one of the things that I learned is once you come down on the weight, the COPD, it gets better. It gets better. Your breathing gets better. There's less fluid, that may build up. That means if you're sticking to a no sodium or low sodium diet and watching what you eat, it's not versus going on a diet. It's just watching what you eat, changing your lifestyle. So a lot of people that have COPD that I know have weight issues, and some people that have COPD have lymphedema. And we all know that we have to be careful with the sodium intake. Why? Because too much sodium can cause not just your legs and your foot swelling, but it also can cause fluid buildup in your lungs, especially those that have heart condition. It can cause fluid buildup in your heart as well. It can also cause you to have a COPD flare up as well. So if you have underlying conditions such as lymphedema, you have a BMI over 30, 60, or 70, or if you have heart issues, make sure you watch your sodium intake. Another thing, make sure you take in all your prescribed prescriptions that the doctor prescribed for you. We know, and I know, that medicine doesn't cure anything. It just suppresses the issue and it helps you. So make sure you take all your prescriptions that the doctor prescribed for you. Make sure that you are watching for side effects for the medication. And make sure you're not drinking alcohol, because alcohol has a drug interacts with medicine. It can cause the medication to weaker. That means the medication won't work like it should. Make sure you're not taking drugs, because a lot of people in America that have COPD, heart issues, lymphedema, they're over, have a BMI over 30, 60, and 70, use drugs and take medication. That don't mix neither. It has an interaction. That means the medication that the doctor give you won't work like it should. Another thing is, if you're experiencing any side effects, make sure that you reach out to your doctor immediately. Some side effects can be fatigue, headaches, stomach cramps, diarrhea, trouble passing your bowels, trouble urinating. That's just some suggestions. Not being able to keep down your food. That's just some basic list of side effects that a person can have. So you want to make sure that you reach out to your doctor if you experience any side effects, any medication. This is something that I do. Each time that the doctor prescribed for me a medication, I always reach out to my mother, which is a pastor, and I ask her to pray over my medication and to pray a prayer to God to make sure that the medication does what it's supposed to do and I won't have any side effects. So far, I have not experienced any side effects of any medications that the doctor prescribed for me. And I wanted to point it out to you all. Make sure that you go to all your doctor's appointments. If you had physical therapy, occupational therapy, even if you don't feel like taking physical therapy, occupational therapy, just let them come anyway. You can sit and talk. You could get a massage. You could do seated exercises, just something to keep yourself active. If you have COPD, lymphedema, and heart issues, make sure that you stay active. Make sure if you have hypertension and COPD, watch your sodium intake. Just wanted to share that with you guys and hope you guys have an awesome day.